Has building Robo Bionics changed you as a person, knowing that what you're doing is impacting someone else on a daily basis?
Since starting with Robo Bionics, there's a design thinking element that just snapped into place. Every single problem is not looked at from an approach that it's a complaint. It's looked at from an approach that what could be done better.
A very warm welcome to the Leaders of Tomorrow Vodcast, your go-to series for unfiltered conversations with entrepreneurs shaping the future of business. I'm Ritwika Gupta, and in this special episode, we dive into the world of medtech and prosthetics in India with Llewellyn Dsa, co-founder and CEO of Robo Bionics. He shares what drew him and his co-founders into this deeply purpose-led space where engineering meets empathy and real innovation changes lives. Take a look. Llewellyn, welcome to ET Now Leaders of Tomorrow Vodcast. It's a pleasure to have you today.
It's a pleasure to be here. Thank you for having me.
So to begin with, tell us, what was the idea, that sort of sparked the creation of Robo Bionics, that you and your co-founders, set up. Was there a problem that you were trying to solve?
No, actually, it was, I would say, a luck by chance opportunity. So, I was working, and during work I decided to pursue my master's, for which I had to quit, and I joined IIT Patna for the same.
Okay.
It's when I was standing in queue for some of the admission process, I seen a batchmate who was without a hand.
Okay.
And that sparked a very interesting emotion, I would say, I had not felt till then, about why there was no solution for him while I was, entering into one of the most premier institutes of the country.
Right.
And that feeling lingered on at least for 6 months or so. And that's when I decided to do something about it. I took it up as a project, and that's how the entire process of building a prosthetic arm began.
But, like you mentioned, it comes from a personal story as well. However, this is not a startup, that is chasing scale or speed in the very typical fashion, if I may say, right? So did you ever worry that, a purpose-led business, it may be harder to do business, when you have a purpose-driven sort of a motive?
Yes, there have been those times where it has come to question. However, each time that question comes up, there's a new story that pops in front of us, proving that no, it's worth pursuing. A very simple thing. So the first time I think this question came up, there was a person who sent one of our first people who tested the device. He, after a few months of using it, sent us a video just holding a matchbox, lighting a matchstick. Think of it was a very basic thing, but it proved that the device could work miracles if the person was invested into it fully to utilize it to its maximum potential, and that kept us going. So various stories like this keep popping up each time to give us that confidence to keep pushing the boundaries of prosthetics ahead.
Right. So when you started out, tell me, what was the initial vision? Was it always to have a product-based company, or was it more about starting a movement around rehabilitation and dignity?
So it started very much like a product company. It just meant to us that we could build a unique or a product that could stand out, and that's all that we thought about.
Yeah.
But as time went by, as our first few fitments went in, we understood it was not just about the product. there were multiple stakeholders involved that had to be, I would say, not just retrained, but brought on board with the entire initiative. The users had to have certain levels of awareness, and all in all, there was a journey that both the clinician and the patient had to undergo, and there were no existing tools for the same. So that's how we evolved from just a product centric company to a movement like initiative.
So when we speak of prosthetics, right, it comes at the intersection of medicine, empathy, and engineering.
Yes.
As a founder, which is the hardest part to grasp so far?
I would say there's a fourth element to it, expectations. That would be the hardest part to grasp because each user, each clinician has their own set of expectations from the prosthetics that's being designed. And sometimes it's not possible to meet all of them. So managing those expectations becomes one of the biggest challenges in prosthetics.
Right. And when perhaps you see one of your users using Robo Bionics device for the first time, what is the initial reaction like, and how do you sit with it?
So I remember the very first time my batchmate used it. It gave me goosebumps, and that was that was a moment where my co-founder Priyanka asked me, "Is this it?" I mean, you've created the product, although with help, but is that it? Is it going to be at this stage itself where it would be left alone in a lab, just forgotten? And that got us to thinking how we could take this to scale. We never knew what a startup was, we didn't know what business is. And it was the first time the incubator itself was coming to function. And that was the first business proposal I guess we must have written as a team. So that one thing kept leading to the other, and things kept working in our right direction.
Right. And when you look at the market today, the prosthetics markets in India, tell me, what's working, what's not working, and perhaps some of the challenges that you faced when you were setting up Robo Bionics.
One major hurdle in the prosthetic market is I would say customers look at it from the perspective of buying an appliance. It's not. Prosthetics are very complex, be it for a leg or a hand, and they're highly customized to each individual. So the first thing was creating that awareness that it's not a typical model like appliance. It's a medical device, and there's a level of customization that goes into each one, and that depends again from clinician to clinician on what they would customize, what they would improve for a particular patient. So once we got through this hurdle where we were able to say a no to customers who didn't cooperate with us a lot, the next hurdle was getting it up to speed. So prosthetics would take 3 to 4 weeks for fitment. We were able to, using our rehabilitation program, we were able to bring that down to a week, making sure people were going home, not just doing some basic activities, but they knew what exactly they could achieve with the level of training they had. And they were aware that after they go home, it's very similar to, I would say, physiotherapy. The therapist's work is to come in and get you doing the exercises once a day. But if you keep it at that, your progression will be very slow. If you are self-motivated enough to practice those exercises maybe 3-4 times without the presence of that therapist, you would progress much faster. So most of our patients are aware that it depends a little more on them than it depends on us just chasing them, and that keeps them going, which in turn helps us create prosthetics even better and better.
So correct me if I'm wrong, but a lot of the innovation in this space, it happens outside of India, right?
Yes.
And yet you chose to build a brand truly made in India. Just talk to us about that.
For this, I have to go back to my batchmate. His name is Jayant. He tried an Indian-made prosthetic, which was a body-powered one. So he found it heavy, and his direct words, and I quote that were, "I need someone's help to wear it. Because of the weight, I can wear it just for 30 minutes, and in that 30 minutes, I can't achieve much." So the prosthetics is more or less like a coat worn just on certain occasions. And when he went to inquire for a bionic device, which was mostly imported, he said the range started at around 12 lakhs and above. And it was beyond the reach of, even considering loans and everything, it was beyond his reach. So when we started researching, we found that you had devices that were intuitive, but they were intuitive from technical standpoints. They were not built from a patient first standpoint. Right. So a very simple thing, if you have multiple fingers of movement, you would need multiple sensory inputs to control each finger, and that used to be the challenge. We don't have that many inputs at the base of our hand. So what we thought was, why not reverse it? We just give the input to open or close the hand like our normal hand, and when we are reaching out to something, our hand automatically conforms to the shape. That made it seem much simpler, and from an engineering point of view, it was easily implementable as well. So that's what worked, and when it worked, we wanted to keep improving on it. So something like sense of touch came in next. The third was app-based control, where you could, without opening up the whole device, reprogram it for a particular user sensitivity. And this is how we kept building on and on.
Nice. Llewellyn, can you take us through the kind of products that you have?
Yeah. So we started with the grippy bionic hand. The base version had just the gripping capability. The advanced version had the sense of touch. Basically, with the sense of touch, you can feel whether you're holding a soft or a hard object, and like a phone's vibration, how you can distinguish between an incoming call and an alert. Here you can distinguish between the hand opening, closing, holding a soft or hard object. And then we have Grippy Connect. This was an offering that started from a concept of, I would say, working with CSR. We had ESG leaders who wanted to show what was the return on investment in terms of impact. And using this Connect system, merging the device with IoT, we were able to achieve that. Tell those leaders exactly where the person is utilizing a device, how much are they utilizing it, what are those grip patterns that they regularly use, and how is the device doing in general, whether it needs to come in for repairs and everything. So other than the grippy bionic hand, the bionic line, we then developed what we call the broadband system. So it's what we would say a mechanomyography based sensor system that tells us where we have the muscles are strong enough to fit the bionic arm, and then we integrated it with a game. So the user now doesn't just look at random graphs which confuse them. They play a game where their movement controls the character, and that character movement actually leads to stronger muscles over each level that they pass.
Nice.
And beyond this, something very interesting about hands, it's something that works against gravity. If you keep your hand down, it can just fall off. So that should not happen. And in order for that to not happen, we need to develop that weight carrying capacity. So we developed what we call as weight band, again a gamified rehabilitation system, where they are controlling a game character, and the movement which they are doing, it may seem like they are playing a game, but it's very similar to holding a dumbbell and exercising. So we are building that strength without the pressure of being in a clinical setting. The patient can be in the comfort of their home, do that activity. The clinician knows the activity that is being performed and how much their strength is increasing, and when they reach the right level, that's when we can fit the bionic device.
So, meaning to say, like when a customer signs up for one of your devices, they're also signing up for the activities, a
Yes.
clinician coming to their place and guiding them on what to do, how to do it. Is that right?
That's right.
Wow. All right. You mentioned that there were certain customers earlier that did not really agree with what you were doing. Is that right?
Yes, we have had some situations where customers, as I would say, wanted it like an appliance, that you tell me how much it costs and I'll buy the device. So we typically would say no to such a customer, because just taking the device, the fitment can be done in 2 days itself. But if they don't know how to utilize it, it's like driving a car without learning how to drive it without having the proper license. It's bound to crash at some point of time.
Do you think there needs to be more awareness about this as well in India?
Yes, there needs to be awareness both from the end of clinicians as well as patients.
But Llewellyn, from what you're saying, it also gives me an understanding that you also had to put a team together, of medical professionals, of people who would actually, of engineers, who would come up with these devices. Take us through that process of putting your entire team together.
So, fortunately, the team would do the execution part. What would happen is, the founder team that we started with, we used to regularly interact with the clinicians, be it the physiotherapist, occupational therapist, and prosthetist, and even some hand surgeons. So, having a training in biomechatronics gave me that background to discuss in a clinical setting, and that would help us very quickly brainstorm and innovate. To give another advantage that our company had, we had 3D printers in-house. Amongst our founder team, we have a skill set where I know design, Priyanka understands embedded systems, and Anil knows software. So merge them together, and I think you can pretty much create any robotic system that is needed.
So it's Priyanka, Anil, and you
Yes.
in the founding team,
Yes.
right?
Yes.
How did you guys meet? Were you friends before, or did you meet for the company? How did it go?
So Anil is a friend since my early school days. I have been taking his help for various projects when it came to coding. And Priyanka has been my batchmate in IIT Patna itself. I met her there. Before Robo Bionics, Priyanka and me, with a few more of our batchmates, had a very short 3-day venture, I would say. It was our college fest, and during the fest, I remember that time Maggie was banned. Just around that time, the ban was lifted, it was just relaunched, and it was not very easily available. And our fest was in Bihar, Patna, as I would say, and the temperature was like 4 or 5 degrees. So it was a very cold scenario. There wasn't much food available during the fest, and we just started off a very simple stall that would sell Maggie and soup. And that was our first venture, which we were very proud of because it was profitable from the first day itself.
Yeah.
So we've had such small moments that I think led to us taking down this entrepreneurial road.
Absolutely. Llewellyn, tell me, has building Robo Bionics changed you as a person, knowing that what you're doing is impacting someone else on a daily basis? How do you sit with that?
Yes, it has made a very big difference, because I think growing up, I have seen situations where there have been people without hands or legs, but it never stuck. I never thought there was anything that I could do for them. But since starting with Robo Bionics, there's a design thinking element that just snapped into place. Every single problem is not looked at from an approach that it's a complaint. It's looked at from an approach that what could be done better, and I think that reflects in our product innovations as well as the culture of a company where from doing things manually, we have certain automations that could do things better than what it could be done manual.
Right. You have been in the business almost 9 years, when we were speaking before the interview.
Yeah.
Tell me, how have you really seen this space evolve over the last 9 years?
We had people who used to typically ask for just for government initiatives or subsidies, etc. From that situation, we have now people asking us, what kind of financing options are available. So, I would say the financial inclusion went up, due to which the acceptance increased. Uh, we now have discussions with CSR leaders where it is looked upon as a social welfare initiative, which was never done so 10 years ago. And one of the biggest change, I think in 2022, the medical fraternity introduced physical medicine and rehabilitation that covers prosthetics and everything into its curriculum. So, I believe the doctors who pass out from from the next year onwards, they would be having that knowledge to deal with PMR better than the doctors before, who had to learn it from scratch after graduation.
Right.
So there's been an evolution in all these spaces, and other than this, the government also seems to be very keen towards working towards the betterment of people with disabilities. The various initiatives like just creating accessible spaces in railways, etc. That tells us that this is a domain that is going to be up and coming for a long time.
Fantastic. Who do you see as competition in this space?
Practically anything that can replace a bionic device. So we've had a very interesting case. He was a doctor himself who had come down from Kerala, and he had no access to bionics. Being a doctor, he was serving in a remote village in his hometown, and he couldn't find a prosthetic clinic nearby. He fashioned himself some, I would say, using help of a carpenter. He fashioned or designed his own prosthetic arm. So even that does become a competition to us, because when he did visit us, he had expectations very similar to that design element that he had put in. And in general, our competition forms the major lack of awareness, I would say. So, if a person is not fitted with a prosthetic in maybe within a year of amputation, they would get used to being without that arm. So, then they would prefer just a cosmetic device that looks like arm rather than something that's functional that would help on day-to-day basis.
And does that happen often?
Yes, it does, because the prescription rate for prosthetics in India is down about low at just 5%.
Let's talk money a little bit, because I'm aware that in the medtech space, it is much difficult to raise capital.
Yes.
Because of the longer cycles of R&D, a lot of research, compliance, regulation. Tell me, how has your journey been?
We've been fortunate enough to have, I would say, to have access to very critical information. So, when we've got incubated at IIT Patna, the first, I would say, validation for our idea was being selected for the academia industry training. That's where I met with fellow entrepreneurs who were slightly ahead of the stage I was in, and I learnt about an initiative of the government called BIRAC. So that gave us the initial starting seed capital to start off the company, to do the necessary R&D. A follow-on round again from BIRAC gave us the necessary access to completing the regulatory compliances, and then came in IIT Bombay as an investor. That gave us the final push beyond the valley of death. So later, post that, we have, I would say, kept our company as bootstrapped to a great degree and focused on building sustainably.
Right.
We have just become profitable, and I think now it would be much easier for investors to understand how the medtech space evolves, and while it does take time, the returns are marginally high.
Fantastic. Yeah, because choosing the right financial partner is also very critical
Yes.
for an entrepreneur today. Also, tell us, how did IDFC First Bank come into the picture?
So we got connected to IDFC First Bank through their Leap to Unicorn, where it was a very innocent application down to them, and they had certain training programs. Now, when the first invite came in, it seemed like a very random invite because we weren't sure if we were part of the selected startups or not. But when I did attend the first session, it made sense because they were calling in seasoned entrepreneurs who had just passed those rounds where we were struggling. And each of those sessions did make a lot of sense to us. Post that, we came to know that we were part of the top 100 startups, and that was truly, I would say, an admirable moment for me and the whole team to be part of such a initiative. And most recently, we came to know about their first Wings program, and we've just, I believe, connected on the same. And we're looking forward to build together with IDFC in whatever way they can help us out.
Fantastic. Llewellyn, tell us, for an entrepreneur who's watching this episode today, who wants to start building something in the medtech space, what advice would you give him or her?
So it would start off as a simple problem where people would not even realize they are in a medtech space. But the moment they do, I would advise them to keep an eye out for how the regulatory standards keep evolving, because in India, they keep changing every 2 to 3 years, and if one of the founders is not very well aware of it, you may build in the direction that you don't intend the company to go into. So that's one thing. The second, I believe, is it would be to innovate as fast as possible, test as fast as possible. It's not from the point of view that it would become an investable business, but I think there's something we call as empathy fatigue. Medtech businesses usually gain a lot of empathy, but if that's empathy for a long time, people tend to fatigue out from it, and it's then just I would say a pat on the back without it actually delivering that value which the company does intend to.
Fantastic. And finally, tell us, what is your vision for Robo Bionics, in the next 5 to 10 years?
So we are looking to take Robo Bionics at a global scale. We've been awarded by the SCN Summit, and I believe we are looking at expanding to parts of Asia, and with the recent European trade deal, I think it's a fantastic opportunity for us to step foot there as well.
Absolutely. Well, all the very best. You're doing something really, really meaningful and life-changing for sure. Thank you so much for speaking to us today.
Thank you for having me.
Thank you so much. Before we wrap up today's episode, here's a quick look at our LOT cheat sheet, a quick rundown of the top takeaways from today's episode. And that's a wrap of today's episode of the Leaders of Tomorrow Vodcast. Stay tuned for more inspiring conversations and keep chasing those big dreams. Until next time, this is Ritwika Gupta signing off.